This medical condition is a lot more common than you think. It's called hydrocephalus, and it's seen in about 1 out of every 1,000 births. And yes, it can happen in adults too. You see, the brain produces something called cerebrospinal fluid, otherwise known as CSF. And there's a complete plumbing system that drains this cerebrospinal fluid from the brain down the spinal cord. And if there's ever an overproduction or a blockage in the drainage system of the CSF, then it leads to accumulation of this fluid. Now, the reason the head gets so big in children is because the skull is comprised of several different bones. These bones join together at areas called sutures. In the spots where there is a lack of fusion, these areas are called fontanelles. And if there's ever an increase of pressure inside of the head, it can release an outward force that expands these bones that are not fused yet. And it can also cause a compression of an area of the brainstem called the midbrain. You can see that the eyes are pointing downwards in this child. These are sun-setting eyes that is caused by something called perinote syndrome, which is caused by a compression of a component of the brain called the rostral interstitial medial longitudinal fasciculus. Now, in order for us to be able to treat this, we have to create a divergent